So I am the dumb son here, and the word dumb is not a clickbait. I'm a medical doctor. Still, I failed to diagnose the reason behind my mother's sudden onset of dizziness, and I call myself dumb for one more important reason. I lived in India for a very long time, till 35. I was there, and I know the system and Indian culture very well. But still, I failed to think of an important clue which might have put my mother's health in a big trouble. That's all this episode is about. Hi, I am Kiran Madhu. I'm an immigrant settled in America, and I bring my immigrant experiences in this channel. So when we bring our parents to US, taking care of their health can be very challenging, and it could be a temporary visit, or we ask them to move here for good. In my mother's case, she's a green card holder. Eventually, she is planning to move here. Like many parents who come from India to US, significant portion of her health care is taken care in India. She is a breast cancer survivor from 2013, and she's a known diabetic and also a known hypertensive. So every year before she comes to US, we make sure she pays visits to all her doctors, gets a thorough checkup, gets a prescription, and then purchases all the drugs, medication sufficient for the time she's going to stay here. She stayed with me for 1 month. Then she went to visit my brother, stayed there for 2 months, and again came back to me. And all these 3 months, her blood sugar and blood pressure were within normal limits, and also she was not having any symptoms. That is more important here. But exactly after 1 or 2 weeks after visiting me for the second time, she started complaining about dizziness, fatigue, and tiredness. And also I noticed her mood is slightly on the side of depression. So you know your moms, right? You know their psychology, you know their language. When they are low, you can easily say that. And the first thing I thought was, a couple of years ago, my dad passed away in the same home. So I thought she might be thinking about that. And I was not thinking about diabetes or hypertension, but I was thinking about she's a cancer patient survivor. So sometimes if the metastasis of the breast cancer, if they are now hitting, and if any of them go to brain, it can make her dizzy. So even after 2 weeks, the situation is the same. Even at the time, I was not suspecting anything related to her blood pressure, because I know that she is known hypertensive. So she takes the medication regularly. But one afternoon, when I'm coming from my walk, I saw her sitting with all her medications in front of her and checking them very carefully. I don't want to take any credit here. She's the one who diagnosed what exactly went wrong. I should really appreciate her for this. So what exactly happened in this case was her anti-hypertensive medication, olmesartan, the blood pressure medication for her. The prescription was for 20 milligrams, and when we purchased the medication in a medical shop in India in a bulk, so some of the packs were of 20 milligrams, but the rest of the packs were for 40 milligrams, which none of us noticed it. And she started using the 40 milligrams. Once when she came here, she was fine because she was using the 20 milligrams, which was her regular dose. And that's when I was regularly checking the blood pressure. And when she started this 40 milligrams, all of a sudden her blood pressure drops. So that is the reason she was so dizzy and tired in the morning immediately after taking the drug. And by evening, when the drug medication effects were a little bit less, she was slightly better. But she already used the high dose medication for more than 3 or 4 weeks. Immediately we changed the dosage to half, but that's not enough, because being a medical doctor, and also it's a common sense, when you use a high dose medication, it can also have some side effects. Particularly in this case, the liver and kidney can be affected. So immediately I took an appointment and checked the renal function tests and liver function tests. Luckily they were normal. So we always have to be aware of age-old Indian culture, how we run the medical shops and the pharmacy shops. 85 to 90%, or even maybe more than that, most of the streets, the medical shops are not run by a qualified person from pharmacology. They can be run by any high school dropout, or most of the medical shops, they just hang a qualified pharmacist certificate on the wall, and anybody can sell the drugs. So when a person is handing over medications in a pharma in India, it is unlikely that he is aware of the consequences of overdosage of the drug. So it is our responsibility to be more careful. And when you are buying the medications in a bulk, like for 6 months or 1 year, it is better to check every pack for the dosage. So that is all I wanted to share in this episode. Thank you for watching. It's just another day in paradise.